So now that every M.B.B.S student who comes out of the college want to go for specialization. Okay, so you have to decide what type of work you are going to do and what is your interest. See, some of them may not be interested in surgical field, some of them will be oriented towards medical field. So you have to audit yourself, your interests, and then self-interest, and what is the scope for that specialty. So that is also important, because as I've seen in the last 30 years, so primarily the broad specialties had a bigger role, like pediatrics, OG, and orthopedics. All those things were specialties by itself. But now it's a time for super specialization. So every subspecialties, there are 5 to 6 super specializations. And previously you can try your hands in anything. So but now it is not like that. So M.B.B.S has become the base, and from then onwards, it is not only the degree that gives you the scope for your career growth, but also your interest. Okay, so if you have a good academic background, you can choose whether go for an academic career or not. And if you are an entrepreneur and you have interest in entrepreneurship, you have to orient yourself to private practice, right? Or you can do, you don't have this administrative capacity or entrepreneurship potential. You have to work in an institution. You have to select your field accordingly. So primarily either medical field or surgical field, or there are now a lot of scope for technology based things. So telemedicine has come in a big way. So you can be an entrepreneur in that, or you can even work in that field. Then artificial intelligence and robotic surgery, then genetics. When we started, there was no such field as genetics. Now genetics and genomics are important things. Then biostatistics, you don't know, right, epidemiology is a big specialty now, and post-COVID it is gaining a lot of importance. So every decade there is a change in the way medicine is perceived. So primarily medicine or surgery or any other interest you have. Then if you are going to select a surgical field, see whether you have passion for doing surgery. The long hours of standing, long hours of work in the surgical field, and then the skill for the surgery. Suppose you want to become an ophthalmologist, definitely you should have finer skills. The hand-eye coordination and motor skills using all the 4 limbs. So some people who have ambidextrous, using both the upper limbs, they shine very well in ophthalmology. Okay, so these are some things you have to analyze yourself. So first you have to do a SWOT analysis. So I would suggest to all people who have taken medicine to do a SWOT analysis yourself. Write it down. So what is your strength? What is your weakness? So what are the opportunities in the field you are interested in? Right, so in ophthalmology there is a lot of opportunities now, which were not there when we selected ophthalmology. And of course there is a threat, right? So automation. So when automation comes into the field, automatically there will be job loss. Okay, so even though the specialty will change, but definitely there will be a job loss. Okay, artificial intelligence, if it comes into medicine, the diagnostic fields can get affected. So you don't need a human behind doing the test. Okay, so all you need is a person who can interpret. So even robots can do that. Artificial intelligence can do that in a much better way. Okay, so you have to think of what are the advances. So doing a SWOT analysis, strength, weakness, opportunities and threat before selecting any specialty is important. So strength, SWOT analysis by personal nature. So you have to critically analyze yourself. So what is your orientation? Whether your interest into the academics, your interest into entrepreneurship, or your primary interest is only getting money, right? So business skills. Then you have to diversify yourself into areas where there will be a lot of scope for getting money. So there are people who are passionate at research and publications. For them, pushing them into a private practice will be difficult. Okay, so you have to, so first thing, do a strength, weakness, opportunities analysis as a person. Then for the specialties you are going to select, and then for the specialty itself. So you have to do a SWOT analysis for the specialty at this point of time.